Welcome back to Breathing for Better Sleep with Dr. Fred Eck, your trusted source for natural airway first solutions for snoring, sleep apnea, and childhood sleep challenges. Today, we're stepping into one of the most misunderstood breakthroughs in sleep medicine, epigenetic therapy and airway expansion. This episode is all about how the structure of your face, jaw, and airway isn't fixed. It can change naturally and dramatically. Let's break down what it means. Dr. Eck, most adults assume their jaw and airway are fully set in stone. What's the biggest misconception people have about how adaptable the face and airway really are?
Well, that's probably the biggest misconception, is that they think it's all set in stone. They think that we're born that way or that it's driven by genetics. But in fact, your jaw development and your bite is only genetic till about 18 months old. And then after that, all the changes that we see are due to habit or environment. So your entire skull and jaws will alter their shape and size based on the concept of epigenetics. It can, in addition to how it's developed through these epigenetic changes, it can actually be altered. So that's the other misconception, is that people don't understand, as an adult, your airway has developed, your jaws have developed to what they are, and it can actually be changed. That's probably the biggest misconception. Most people are not aware that it can be changed, and it can be changed all the way up till about age 90.
It's almost like your body composition, right? You can change it with exercise and different lifestyle habits. So that's what you can do with your face and your jaw and your airway as well. I'm guessing.
Putting it under better function, stimulating the body's stem cells to help heal itself. We'll clarify kind of how the process works a little bit later, but it can all be altered. It's like going to the gym and altering your physique, right? You can do the same thing with your jaws and your airway.
And you use the word epigenetic, which sounds scientific and intimidating. In plain English, what does that actually mean in the context of airway expansion?
How I explain the concept of epigenetics is nobody is genetically programmed to have a small palate or a bad malocclusion. Nobody's genetically programmed to have uneven eyes. Nobody's genetically programmed to have one arm shorter than the other. Mother Nature is just better than this. When these things happen, something, habit or environment, caused it. It altered the way you grew, and you did not grow to where you were genetically programmed to go. So when we're using epigenetics to fix the problem, we are utilizing your body's genes and stem cells to help develop that lost space in the airways and that lack of growth. So it's the most holistic, natural way of correcting the problem.
And why do you think so few doctors talk about structural change? Is it a training gap, a visibility issue, or just outdated assumptions?
Most people are not broaching this subject because they're just simply not trained. It's a training gap. Airway and sleep, as it's currently done, has been around and being done this way since about the early 80s. It is such a rapidly changing area of medicine. But most doctors have their head in the sand. They're just ignoring or not educating themselves on the new science. They're practicing like it's the 1990s and early 2000s, and there's just so much more available that nobody's paying attention to.
So let's take the listeners inside the body. When someone starts expansion therapy, what's actually happening at the bone and tissue level?
Well, let's start by clarifying. When we say expansion, we should clarify and be saying epigenetic expansion or epigenetic jaw development, because that's primarily what we're doing. If you just use the word expansion alone, that implies to the average person an orthodontic process. And what we're doing is not an orthodontic process. We'll clarify this a little bit further when we discuss this and how it varies from traditional orthodontics. But it's a little bit hard to understand for those audio guests alone, but if they can have a chance to watch the video, it'll help clarify this, but I'll do it as good as I can. Our skull and our jaw, our upper jaw, grow through what's called suture lines. One of those suture lines is right up the middle of our palate, from front to back. Okay. We use a removable appliance that you only wear at night, and that stimulates the body's stem cells to remodel and utilize the osteoblasts to lay down new bone it can lay down bone in the palate. It can lay down bone through any of those suture lines, which is why you can actually get some correction of asymmetries like uneven eyes, etc. So ultimately what you're doing is you're stimulating the osteoblast cells, which are the cells that lay down bone. So kind of if you want to use it in terms of orthodontics, when we do orthodontics and we move teeth orthodontically, osteoblasts are also the same cells that are responsible for laying down new bone behind the moved tooth.
So there's actual growth happening. There's bone growth or bone movement. Is it more movement or is it growth?
It's growth. So you lay down new bone and it's growth. So unlike orthodontics where you are just expanding or moving teeth, now in a child, you can get some growth in a growing child by doing orthodontics. In an adult, you do not get that growth. The only way you get growth in the airway and that palate on an adult is through epigenetics. You're not going to get that through traditional expansion orthodontics.
And is expansion primarily about making more space, or is it about restoring the shape someone should have grown into? I think you mentioned it already a little bit in this beginning of the episode. But can you go further into this? How is it restoring? How does the body remembers how the path it should have taken and how it didn't take that path due to lifestyle habits that weren't conducive to their optimal growth? Or how does it work?
So your genes essentially are going to control the growth. So you can only grow or develop to where you were genetically programmed to go. And any of these suture lines in the skull and maxilla that have deficiencies can recover some of that lost growth that never happened. This is why we can oftentimes fix asymmetries and other problems in addition to expanding the palate. That's why this is a three-dimensional process. It's not just a two-dimensional widen the palate. It happens in all three dimensions. Then when you widen the palate, that's the same bone as the floor of your nose. So as you widen the palate, that is how we non-surgically widen the nasal airway. Simply improving swallowing and tongue posture to get the tongue to set up against the palate, especially in a growing child. This can help establish and reestablish nasal breathing, but also additional development of the maxilla in a growing child. You know, I always state, and anybody who deals with airway, especially in children, know the tongue is the best orthodontist in the world. If the tongue rests against the palate where it's supposed to, that will help develop and widen the palate. When the tongue, and we have what's called a myofunctional problem, the tongue does not rest where it's supposed to, and it rests more down and back in the floor of our mouth rather than up against our palate. That's when our palate develops narrow and kind of that V-shaped or vaulted palate because the tongue's not up there where it's supposed to be.
Does that affect both top teeth and lower teeth? Does lower teeth also affect the airway development or not?
So when you can have, with these myofunctional problems, you can create orthodontic issues. And one of those orthodontic issues is a growing in a vertical component, narrow component, as opposed to a wider jaw. Also, your lower jaw can develop short, what we call a class 2 biter. You know, you see those kids that look like they have no chins, right? And if our lower jaw is short like that, that leaves less room for our tongue. Anything that leaves less room for our tongue creates an airway problem.
Okay. And if you look at two adults with similar sleep apnea but very different jaw structures, what clues help you instantly see who might benefit from expansion?
So if you want to look and see who will benefit from epigenetics, it's pretty much almost anybody with an airway issue. When you start treating this, you start to realize how many people who have an airway issue have these epigenetic growth issues. But some of the common signs that we see to give us an idea if this treatment will work for somebody is, do they have narrow nasal passages? Do they have a narrow palate or upper jaw? Do they have a short upper jaw? Do they have myofunctional issues, things like a tongue tie, speech problems, orthodontic issues like crowded teeth? These are all signs that there is a growth and development issue. Keep in mind that epigenetic treatment is so much more than just palatal expansion. We'll talk more in the future about the benefits of sleep apnea patients receiving epigenetic treatment, even in the absence of a narrow palate. Not everybody has to have a narrow palate to be a candidate for epigenetics. That's just one of the things we look at, but it is a common sign for a lot of people.
Interesting. And what are some surprising symptoms unrelated to sleep that improve simply because the airway gains a few millimeters of space?
Yeah, when you help to tone the muscles of the airway and you help to develop the airway, there's so many benefits that a patient can see. It includes, improvement with chronic sinus problems. Your sinuses drain through the middle entrance of your nose. So if you have a narrow or blockages in your nasal passages, that can be the root cause of your chronic sinus problems, right? Gained energy, facial symmetries, nasal allergies, chronic cough, chronic choking, acid reflux. These are all things that patients can benefit from improving these things through their epigenetic treatments. When we look at kids, mood disorders, ADHD, we talked about that before, bedwetting in children. These are all things, anxiety, depression. These are all things that can be improved through epigenetic treatment. Two very common things that a lot of people just don't pay attention to, but they're very common in people with airway issues and especially epigenetic growth and development issues. And that is tinnitus, ringing in the ears, and vertical balance issues. These are very common problems with people with airway issues and epigenetic changes. And those can be improved in most patients.
Wow, I would have never thought that acid reflux was one of the symptoms. You usually relate it to food, what you eat, that causes the reflux, but it's interesting how the construction, it would be the airway construction that creates that.
So what happens is as we stop breathing and we get this alteration in the pressure in our tube, right, which is essentially our airway, we have two muscle sphincters. One's up high, one's down low. Those can open when they're not supposed to. If the lower one opens, that's what allows acid up into our airway and creates acid reflux. And that's why when you treat sleep apnea, you can oftentimes improve acid reflux. If the upper muscle sphincter opens, that can create a chronic cough or chronic choking. Like people can literally choke on water, right? Because of that upper muscle sphincter in the airway.
That's very interesting that you mentioned that. My mom often chokes out of nowhere eating, but it's not like she swallows something that she shouldn't. It's just like she starts choking, and she doesn't know why, and she gets really scared. So this is really eye-opening. I'm sure a lot of people experience that and would never point it to this.
It's a very common thing. And we often have patients who come in who have gone through a throat stretching procedure multiple times. And this root cause is oftentimes simply missed.
Oh, throat stretching has nothing to do with epigenetics treatment, right? That's something completely separate.
So there's a throat stretching procedure that they do for people who have that chronic choking problem. like people who choke very, very easily. There is a procedure, a surgical procedure, that they do, and it's essentially aimed at trying to just stretch the throat, essentially.
Okay, but it wouldn't actually fix the root cause. I
No,
see.
if the airway is the root cause, that's why it relapses, and these people go through the process multiple times.
How does the tongue respond to expansion? Does the tongue posture improve naturally as the mouth becomes more spacious?
Yeah, as the palate grows from a vaulted, narrow structure, which is not what the tongue is designed to rest against, right? It's designed to rest against a fairly flat, wide surface, kind of the shape of the tongue. So when it's vaulted or narrow, the tongue oftentimes just doesn't naturally go up there because it feels weird. Once you get some of that expansion and help develop the arches, the tongue can then naturally just go to where it's designed to go.
And Dr. Eck, you've worked with expansion for years. Should we call it epigenetic expansion?
Well,
Epigenetic?
we do primarily we do both. So we do on adults, it's primarily epigenetics. Okay, in a child who's a growing child, we can use traditional orthodontic methods to some degree, and we can use epigenetics. So it can be a combination in a growing child. But epigenetics is what we focus mostly on. But there are some traditional orthodontic stuff that can be done in growing children.
Okay, and have you noticed patterns, certain types of patients who respond especially well to these treatments?
Most patients will respond well so long as they comply. Now, obviously, if we're talking about children, they respond the fastest. I mean, they can develop very, very rapidly as a growing child. My big focus for the last several years has been trying to get the word out there on treating these kids early and helping to create the development so you avoid this person who's an adult with moderate and severe sleep apnea. And you can do that if you treat them early enough.
You can correct, it's easier to correct the path a kid is growing than try
Yes,
to make an adult that's already fully grown to change its shape, right? Like the kids are still constructing their shape, whereas an adult is not fixed, but it could.
As an adult, it just takes longer and it's more involved. It can be done. So if you have moderate and severe sleep apnea, we can treat it very successfully through epigenetics and these methods. But when you're treating somebody that has an airway problem as a child, it can often be done very quickly, and you can actually eliminate and prevent them from becoming an adult with sleep apnea. So it just makes it faster.
Is it uncomfortable treatment?
No, it's not like rapid palatal expansion, a traditional orthodontic issue, which can be painful, or the surgical orthodontic option that's out there now. Most people refer to that as a MARPE procedure, where rather than develop growth in the jaw, you're literally essentially rapidly expanding the palate to the point you break the palate. So yeah, those are not pleasant procedures. Epigenetics is very simple, very easy.
Okay. And expansion is still new to many adults. What's the moment that you usually realize, whoa, something's really changing?
I mean, for different people, that's kind of dependent upon what their chief concern is. But in general, once they can sleep through the whole night and they're not up 4 times a night to go to the bathroom, okay, or they can finally breathe through their nose, which they've never been able to do their whole life. And of course, one of the big things is their spouse will sleep in the same room again because they don't have the snoring or the restless leg, kicking leg, and all that stuff.
For someone who feels stuck, they've tried CPAP appliances, lifestyle changes. How does expansion open a door they didn't know existed?
Well, there's the problem is they didn't know there were other doors, right? They're given door 1 and 2. They're given CPAP and they're given a surgery, right? They feel stuck because nobody's given them any hope of any options outside of the CPAP and surgery. So we expose them to a whole new world because there's so many options that most doctors are just simply not talking about and not trained in.
So I guess it just gives them hope, because a lot of people try the CPAP and they see it doesn't work, so they think their sleep disorder or their sleep apnea is something they are going to have to live with for the rest of their lives.
Yeah, they feel like, they feel like it's a life sentence that can't be cured. But if you get to the root cause, and I always say the same thing over and over and over again, if we get to root cause, sleep apnea is an insomnia. It's just symptoms. There is a root cause to the sleep disorder. If we get to the root cause, we can actually cure the problem once we know what the root cause is.
How long does it typically take for expansion therapy to confidently show airway improvement? Weeks, months, years?
When we start epigenetics, we will start to see bone growth within a matter of 2 or 3 weeks. And it will continue for a period of time. And that is all dependent upon each person's where they started and where their genetic potential is. So if you have a very, very vaulted, narrow palate, so a normal upper, what we call intermolar distance, measured from first molar to first molar, is 42 to 45 millimeters. So if you're 30 millimeters to start, okay, then you might take 6 or 8 months. If you're 19 millimeters to start, it's going to take longer to get all of that growth. And the younger you are, the faster it is as well. That's why we talked about that in the kids. It can be anywhere from several months to the longest cases are typically 18 to 24 months.
Okay, and that's really not a lot of time for someone who's probably suffered sleep apnea for years and years and years.
And they don't have to wait. They don't have to wait until the end to get improvement. They will literally start to get improvement in weeks or within a couple of months. And it just keeps improving and keeps improving.
Yeah, I was just going to ask you that as soon as you start feeling that bone growth, you start feeling the improvement. It's not just something that you as a doctor can see, but the person will start to feel it.
They won't feel, per se, bone growth. It's a very passive procedure. It's not something that you actively feel. What you feel is the change in your breathing, the change in your snoring, how you feel during the day. Your symptoms improve, but you don't actually feel the bone growth.
And I think I've asked you this, or you've mentioned this before, but just to reaffirm to people, is there a point where someone is too old for expansion? Or will the body stay more adaptable than people assume? Like, no matter how aged you are.
There is a big misconception by a lot of doctors of all types who don't understand all of these suture lines throughout the skull in the middle of our palate. They are not fused, right? They're pliable and they can move and they can get locked up. And they can continue to utilize the stem cells in these growth centers until about the age 90 or 91. So by about age 91, most people's sutures are starting to fuse. But prior to that, I think it was the last episode we were talking about a gentleman that we finished a few months back. He was 87 years old. And this is, what he looks like. And I can put that in the for those people, in audio, it's hard to understand it. But if you can watch the video, this is a gentleman who's 87 years old who wore an appliance. And this is a real simple. You wear an upper appliance at night when you sleep. And he got improvement starting within a couple of months. And it continued to improve. And at 18 months into the procedure, you can see on these pictures how much wider his airway is. And he now went from having sleep apnea to no sleep apnea. He does not have to wear anything, no appliance, no mask, no nothing. He's cured at 87 years old.
Wow, that's really incredible. This is really remarkable, actually, that you can, feel hopeful no matter what age you are. And in terms of the appliance, is it more comfortable than the mask? CPAP, for example.
Yeah. I mean, in my experience, only about a third of patients that try a mask can actually have success with it. and wear it comfortably for a period of 6 or 8 hours, which is what you have to utilize it in order to get medical response. Okay. Insurance purposes, I know they say 4 hours, for that, but for actual medical purposes, it's 6 or 8 hours. Not many people can tolerate wearing a mask for that long. The appliance is so much easier to wear, and that's all. And there's lots of studies done on compliance, and patients' compliances, and the numbers are somewhere around 80% of people given a CPAP are not wearing their CPAP 12 months later. So that tells you it's not comfortable for most people, not effective for most people. Whereas it's the opposite. About 85 to 87% of patients giving an oral appliance are still wearing it 12 months later. So they're much, much easier to wear, which is why people continue to wear them.
And is the appliance a short-term thing, or is it a forever treatment? Like, is it something that you adopt as a lifestyle thing? Every night you use the appliance, or as you progress, then you don't need it anymore?
A CPAP and what we call a mandibular advancement appliance, those are for life no matter what. When we do the epigenetics, that doesn't always have to be the case. The 87-year-old gentleman we were just talking about, myself, I was a severe sleep apnea patient. I don't wear anything anymore. I don't have sleep apnea anymore. So when we get through with treatment and we do our final sleep test, we're doing a 2-night sleep test, 1 night with the appliance in place and 1 night without it. So if we can see if your numbers are good enough without it to not need to wear anything. And about 70% of our patients, when we're done, don't have to wear anything. Some people do, and it's based on their anatomy. And they can oftentimes can eliminate it by doing some other procedures. But yeah, it doesn't have to be a lifetime thing for many people.
And if a listener is curious but is skeptical, what's the simplest way to find out whether they're actually a candidate for expansion or not?
I mean, the easiest way to know, and the only way we ever know, what treatment options are. So keep in mind, a sleep test tells us what's going on. How much you stop breathing, how much you snore, your oxygen level, stages of sleep. It's the what. The 3D imaging is critical because that's the why. So to know what's going on and to know if epigenetics and or palatal expansion can be of benefit, then you need a 3D image that allows us to see your airways, your sinuses, your jaw development, jaw size. And by doing that 3-dimensional image, we can see what is contributing to your sleep apnea and whether or not you're a candidate for that or not. Keep in mind, there are so many changes through the epigenetic process that it goes beyond expansion of the palate, toning the muscles of the airway, training the tongue position and posture, raising up our hyoid bone, which is something that happens when we're doing epigenetics. All of these things improve airway and improve breathing. It's not just expansion of the palate. I always say epigenetic treatment is not appliance therapy. It is a protocol that happens to include appliances, but it's not just about what an appliance does. There's more to it.
And if any of us want to start treatment with you, should we come see you to get tested and then we can do follow-ups online, or is it always in? So
depending on where you're at, we can do, obviously, we have people who come from all over the world, and all over the country. And so, yes, anybody can come here and we can treat them here. For people who live a long way away or out of the country, we do some of our visits through telemedicine and webinars, so that we can cut down the number of visits that are needed to actually come to the office.
Okay. So we've reached the end of our episode. Dr. Eck, is there anything else that you would like to leave the audience with today?
Pretty straightforward. I know it sounds confusing, and it sounds like a lot of science, but it's actually pretty simple treatment. And this isn't something that's new, by the way. There were orthodontists back in the late 50s doing this. They didn't know what it was called back then, and they didn't always know why it worked. But this is something that some people have done for a long time. So it's not something that's brand new. And the concept of epigenetics and proper mouth breathing and proper tongue position, none of that is new either. We've known this for a long time. So I think my biggest thing is when people want to say, oh, this new thing, this isn't new. Not new at all.
It's not new, it's just unknown for a lot of doctors. So this wraps up this episode of Breathing for Better Sleep. If you ever been told your airway problems are genetic, permanent, or just bad luck, today's conversation shows a different truth. The airway can change, and when it does, everything changes. Share this episode with someone who's searching for real solutions, and visit sleeptreatmentdirect.com to learn more about epigenetic therapy and airway expansion. Better structure, better sleep, better life.
Thank you.